Hey, here's some good news. We are getting more evidence, at least, that the latest COVID wave here in Connecticut is subsiding. It had just happened to start right around the time that the state changed its test reporting requirements, which was back in early April. So I'm only showing you from that point on here. But even with these limited data, the trend is getting clearer from the positivity rate, at least. It also is from hospitalizations as well. If we switch to that in the next second, it's a similar kind of curve. You can see hospitalizations, and again, not everybody who was hospitalized because of COVID. These are just COVID-positive hospitalizations overall. They seem to have peaked in the high 300s, which is about the same peak as the very first Omicron wave last August. Now, this is good news. The funny thing is, it probably wouldn't have been good news if we told you 2 years ago that this was all happening right now, because way back then, at the start of the pandemic, there was a lot of optimism that COVID would be gone entirely by now, or at least just a seasonal thing. At this point, though, it's becoming clear that this coronavirus, for better and for worse, is starting to behave more like other coronaviruses, which tend to cause the common cold and to do so year-round. So I guess it's time to change focus a little bit. This is how hospitalizations have looked ever since the start of the pandemic. We used to look at these and wonder just how high were these waves going to go. But I suppose at this point we should also be looking at how low they get in between the waves. How low do we get here, and here, and here, and especially over there? In other words, just what is our baseline level of burden to our healthcare staff going to be for this virus going forward? Also, how many deaths can we expect? Throughout this latest wave, we never averaged more than 5 COVID-related deaths a day over a 2-week span. That's the orange line here, and here's the 5 threshold. So that, in and of itself, is good news compared to where we used to be. And remember, even though deaths usually lag positivity rates and hospitalizations, they do, I think, appear to be declining already in this latest wave, although they seem to be getting reported in bunches. In fact, 32 were reported on Wednesday. So we could use another week of data to try to get a better idea if deaths are going to continue going down, because at times they've gotten as low as under 1 a day in Connecticut. Erica.